So up next we have Amanda Fitzwater. Amanda was born and raised in Poplar Bluff, Missouri. She attended Central Methodist University and received her Bachelors of Science in Psychology. She's currently working at Butler County Health Department as a prevention specialist for HIV and STDs and an HIV medical as an HIV medical case manager.
Hey guys, my name is Amanda Fitzwater, and I am the prevention specialist for 20 counties, and St. Francis is one of those counties. So I want to talk to you about harm reduction. This is something we all need to learn and implement in our lives. So the definition for harm reduction is a public health strategy that was developed initially for adults with substance abuse problems for whom abstinence was not feasible. Harm reduction approaches have been effective in reducing morbidity and mortality in these adult populations. So harm reduction has been successfully applied to sexual health education in an attempt to reduce both pregnancies and sexually transmitted diseases, including HIV. So as a harm reduction practice, we need to learn to be sensitive to people and not call names or be judgmental, because that's what is making them less able to come talk to us. So we don't want to use words describing them as junkies or misusers, because that makes them feel bad and they feel like they can't come to us for help. So we should always use proper terminology when talking to people, okay? Next, please. So I love this picture right here, because addiction does not discriminate. Anyone can become addicted to something. And so this is what we all need to pay attention to. It could be your grandma or your mom or your kid. So it does not discriminate. It takes that one time of them taking something and misusing it. So I want to talk to you about Narcan. So I know they're giving out Narcan after here, so I just wanted to talk to you about it. This is what Narcan looks like. It's small. And it takes just one little press, and you could save someone's life. I mean, that easy. You just press it and insert into the nose, and it's that easy. Narcan is a powerful thing, and if you have the chance to save someone's life with it, it's fantastic. So in this next one, it can be as easy as this by saving someone's life. Just this little thing right here. Next, please. I do want to tell you some of the signs and symptoms of an overdose. So you'll see the pupil here is small. It's like a pin. Shallow breathing, choking or gurgling sounds, pale or blue, cold skin. So if you come across someone like that, you definitely should be cautious. Also, the good thing with Narcan is that, say you think someone is overdosing and you hit them with Narcan and it's not an opioid overdose, it's not going to affect them or hurt them in any way, okay? So here are some things that we should do if you come across an overdose. Call for 911 and give a dose of Narcan. Then you want to administer rescue breaths. Stay with the person. Sometimes it might take a second dose of Narcan, especially when fentanyl or something's involved. I've heard from our drug task force that sometimes they've had to give like 4 or 5 different hits of Narcan, and it still didn't help. So in this next one, I'm going to show you how to use the Narcan. So today when you get your Narcan, and if you ever have to use it, you know how to. So you're just going to peel that back, see this little thing here, and like I said, it's just this is what Narcan is. It's nothing scary. It's easy to use. And then you just press, and it administers the spray. That spray is what's going to help them come out of their overdose, okay? So after they come out, after the overdose, there could be some other side effects. Sometimes they can be angry, get violent, they could vomit and be combative, because this is sending them into a withdrawal. So this is taking that high away from them, and they don't want that. So next, this is Narcan. If you want training on how to use Narcan, or you have a facility, I know when we went and did our training, we did it through the Mo Hope and More project. So I wanted to give you this information so you had it at your fingertips. They are willing to come to you, or if you want to reach out to someone close by and get trained, it's very easy. The other one is the More. Okay. Next. So I want to talk to you about safe syringe programs. We don't have any near here, and I think they're very important. Everybody gets nervous when they talk about syringe programs and us giving needles to people. But the important part is we're keeping those dirty needles that could be infectious in some ways, like with HIV or hepatitis C, out of our parks, out of just anywhere. Because I know in Poplar Bluff, you can walk down the street and you're seeing needles laying everywhere. And we don't want our children, our grandchildren, our family members to come into contact. And so that's why I think giving clean syringes to people who use drugs is very important, because then we're taking in those bad needles that could be infectious to people and we're taking them off the streets. It also helps give us that rapport with the client where we could potentially get them into treatment one day and help them get off the drugs. I want to show you a few harm reduction toolkits. So you can take sharp containers. They give out cookers for people to cook their drugs, because a lot of times they'll use spoons and they'll share those spoons with the water and drugs in them and they'll just inject it. There could be blood in there, and then that's where it's being transmitted. So we're offering different ways to be safe. I know a lot of people dislike that idea, but like I said, if we can make it safer for them, and it makes it safer for our community too. I wanted to tell you about this. I don't know if everybody remembers in Illinois, Scott County, there was that HIV epidemic, and it was huge. 142 cases, and it was all linked to IV drug use. They were all sharing their equipment and needles, and this is how the outbreak started. So this is why syringe programs are so important, because on this last slide that I have, the CDC said that Missouri has 13 counties in Missouri that are risk for an outbreak like what happened in Illinois. And out of those 13 counties, St. Francis is one of them. So this is why it's so important. I do prevention, like I said, for 20 counties, and I have at least 5 or 6 of those counties under my prevention. It's important to keep our communities safe. And this should be a huge testament that the CDC is saying this could happen to your area if you're not careful. So taking these measures and being safe and cautious is important. So if you're not up for syringe access, doing other things in place could make it better. So I'm all done.